Module 5. Physiology, Respiration. Dr. M. Ashraf Thind, Founder and CEO of Dr. Sheen Medical Lecture. Superfast Simplified Physiology. Video Lecture Notes. Guyton and Hall, 14. Edition, Chapter number 43. Respiration Lecture number 10. Learning Objective. Discuss FEV1, FVC ratio, and its clinical significance. Complete concept of FEV1, FVC ratio. It is useful clinical pulmonary test. It is easy to perform and to record the forced expiratory vital capacity, FVC, on a spirometer. The FEV1 FVC ratio is a measure of the amount of air that can be forcefully exhaled, expired, in 1 second, compared to the total amount of air that can be exhaled forcefully after taking a deep breath. Complete concept of FEV1 FVC ratio. The person first inspired maximally to the TLC and then exhales into spirometer with maximum expiratory effort as rapidly and as completely as possible. It is normal graph. On x-axis, given time. On y-axis, given lung volume change, liters. In the normal person after maximum inspiration, 4 liter, then air expire, exhale. As soon as time increase, volume of lungs after 4 seconds becomes decreases, all air exhales becomes 0. You can see in graph after 1 second, the 3 liters volume of air exhaled. This is FEV1, forced expiratory volume during the first second. In this case, FEV1 is 3 liter and FVC, functional vital capacity, is 4 liter in first second, or in 1 second, too much rapidly expires, then gradually expires in 4 seconds. See in graph 43.3a. In normal, greater amount of air is inspired, but then in 4 seconds, all air is expired. Then we draw a ratio, the volume change divided by the air expired in the first second. The ratio in normal person is 80%. That is a person as much as air is inspired. The person expires in 1 second. Exhale in normal lungs. In graph 43.3b, less air is inspired, 3 liters, but the person takes long time to exhale, expire. Due to airway obstruction, the ratio is 47% in first second, expires. In persons with serious airway obstruction, such as acute asthma, this value can decrease to less than 20%. It takes more time to expire. Clinical significance. It is used to diagnose and monitor respiratory conditions such as asthma, COPD, and restrictive lung disease. A low FEV1 FVC ratio is indicative of an obstructive defect. It is typically seen in asthma and COPD and can be reversible in asthma but not in COPD.